And so when you think about people accessing abortion and Minnesotans having to travel outside of Minnesota to access abortion care, it's because there's only two locations, Whole Woman's Health Bloomington and Planned Parenthood in St. Paul, that are offering in-clinic abortions up until the second trimester. And then the Duluth offers up to 16 weeks. So first trimester person is waiting. A second trimester person is going to have to wait even longer. So that's why we end up sending people out further to Seattle. I have somebody in my emails right now. We're going to Colorado.
We're rolling. We're rolling.
This is a real thing. Real thing.
None of you have the balls to stop this. Stop this.
I've got plenty of time. I have nothing else going on today.
We're in the Wedge neighborhood right now.
This is the Wedge Live podcast. I'm your host, John Edwards. I'm joined today by co-host Jason Garcia, who is also a producer on this episode. And our guest today is Shayla Walker from Our Justice, which is a reproductive rights organization that raises money to provide resources for people who need reproductive health services, abortions, and I don't think people need this to be explained to them what's happening with the Supreme Court. I think we have settled that, and we could just jump in to what your mission is and how you're trying to address that problem. Sound good?
Yeah, that's fine. So again, my name is Shayla. I'm the executive director of Our Justice, and Our Justice, we're a reproductive justice organization. And justice is a little bit different than reproductive rights in the sense that, reproductive justice was created by Black women in the 90s. And it's when all people and communities have the economic, social, and political power and resources to make healthy decisions about our bodies, sexuality, and reproduction. So it's I would say, social justice mashed up with reproductive rights, and they had a baby, and that was reproductive justice.
Thank you for that clarification. I think it's important. I was watching your presentation to the city council yesterday, and something you said, I think, boiled it down very simply to me in a way that I hadn't heard it put before, because I'm you want to know what you can do. You don't want to feel hopeless. It's and so I want to play this clip from you.
Consider all of these barriers that I just listed to getting an abortion in Minnesota, and then consider the fact that Minnesota could be the only state in the upper Midwest with legal abortion if the leaked Supreme Court majority opinion becomes the final decision, overturning Roe v. Wade. Clinics are already overwhelmed with the amount of patients they are serving today. Today, I just served somebody who said the first appointment that they could get was on June 1st. That's about 2.5 weeks from now. We have a lot of work ahead of us to prepare for an increase in people traveling to Minnesota for abortion care. Estimates say that the travel to Minnesota could increase by 350%.
A handful of things I'm hearing from you is Minnesota has barriers that exist, and I'm not sure enough people are aware that we're not the paradise, the refuge for people that we think we are. Also, the demand for people coming in is going to increase significantly in the near future, and so we need to be thinking about resources to put into that to address that problem, as well as the activism to remove the barriers. Can you talk about that?
Yeah, for sure. It's just so funny because when I got that text in the evening when the leak happened, I just thought to myself, oh my gosh, everybody's gonna know what we've been knowing for years now. I feel like it's just a small 4% of people who knew this was coming, and it's just because we're deeply engaged in this work. But because of the work that we've been doing around trying to remove the restrictions that Minnesota has, we knew that these things were on its way back in 2019. So back then, our justice, we were just a small team. And when I mean small, like today we're small. We have 3 staff members. That's what we have. In 2019, we had 0 staff members. And we were approached, and we knew that there was something that we could do about the restrictions in the state of Minnesota. So we were approached by our friends at Gender Justice, and they were talking about, hey, we want to remove the restrictions. And what a wild idea it would be to, like, as a group who has no staff, who has like 2 or 3 board members, be like, yeah, we'll sign on as plaintiffs to remove restrictions, because we know one day in the future that it's going to be really powerful and meaningful to have these restrictions removed, because we don't know if Roe is going to be here. And not only that, if Roe is going to be here, that Roe is already here and it's not doing what it's supposed to do for folks. So we saw this back in 2019, and that's what we've been preparing for. That's why we joined on to the lawsuit, where right now we are attempting to remove the restrictions in Minnesota that causes barrier to abortion services. So like some of them are 24-hour waiting period law, the judicial bypass, where the minors have to go and get a permission from a judge that they've never met, who will tell them like, hey, I know that you're not responsible enough to decide whether you're going to raise a person, but I'll make that decision for you. So yeah, we knew that back in 2019, even before 2019, we just had an opportunity in 2019 to actually sign on to a litigation and do something about it. And since 2019, we have been running a coalition and campaign trying to educate Minnesotans, let them know, like, hey, these laws that we have in the books are not in alignment with what our state constitution says. Our state constitution actually has more protections than the federal constitution, offers us more protections than the federal constitution, except legislation keeps passing these bad laws. What's the point of a constitution if folks can pass shitty laws?
Right. The 24-hour waiting period seems particularly, like, that's an easy one to communicate to people. Like, if you go seeking medical care, you expect to be able to receive it and not have an arbitrary time put on it, especially in cases where the service is not close to you to begin with. You've traveled a long distance, and to get there and have to wait a day is pretty egregious. Is there any hope of changing the law? Because we talk about the Republicans in the state legislature all the time as a roadblock. Is the hope to flip the Senate to get these things passed?
I think the hope for us is to win the litigation, honestly, because the litigation is going to address all the laws, like not just like, you know, if we do it bill by bill, you can take a law here, take a law there, but why not remove all the restrictions with one broad sweep?
Right. Yeah, let's hope a court does a good thing for a change. Right?
We can only cross our fingers.
Jason?
Yeah, so one of the things, you know, that has definitely become a much bigger topic of conversation, I would say, online and in the real world, I'm hearing, you know, the term abortion funds a lot more. I feel like I've been fortunate enough to have been engaged with this sort of work to know what abortion funds are for quite a while, but it's like for a lot of people, it's a really new concept. Can you talk about our justice's role as an abortion fund and like what that means and what you do in that regard?
It's interesting, Jason, that you said like for a lot of people, it's a new concept, especially since we've been around since before Roe v. Wade. A lot of people don't affiliate or associate abortions with the church, but that's who we were started by, clergy folks and doctors, raising money and driving people to other states so they can access abortion care. And, you know, I see a lot of talk online and people like are really excited. They want to get in the know. And it's important for them to know that there have been abortion funds on the ground working, raising money, and not only just abortion funds, but logistical support groups who've been getting people from A to B. When we talk about what's going to happen if and when Roe falls, and us being like quote unquote island of access, like, and I think people think like people from North Dakota, South Dakota, Iowa, they're going to come here. It's not just those folks, because those folks are going to come here. They do come here, but we've already seen folks from Texas. We've already seen folks from other states that are further away. It's not just about like what's closest to you, but what's more accessible. Like, where's your community at? If you are in Alabama or in Georgia and you have folks here, you probably will come all the way to Minnesota rather than go to another state closer than you. Maybe the flight tickets are going to be a little bit more affordable, so that's going to determine where you go. And so that's what not only the abortion funds, but the practical support groups, that's what we have been working on. There's like a whole system of people working on maps that layer on information from the funds, layer on information from the clinics, like which clinic does which services, and then on top of that, layer on information from which practical support organization does doulas, which ones do lifts, which ones do volunteer rides, which ones do hotel stays. So we've been working on this for a long time, since Dobbs. I feel like the practical support organizations have been working on mapping out or creating a map so that people can have more accessible ways of access of figuring out how to get an abortion in the U.S.
I think one of the things that you kind of touched on there is really important as well, that here in Minnesota, people can often think like, oh, there, in addition to there being no barriers or things like that, people often think that any Planned Parenthood or any clinic can offer abortion services, when in reality it's pretty limited. In terms of Planned Parenthood, there's Minneapolis, St. Paul, Brooklyn Park, and Rochester are the only ones that offer abortion services. And then for independent clinics, there is Duluth, Robbinsdale, and Whole Woman's Health in Bloomington. So that leaves a lot of the state uncovered. There is Just the Pill, which is a mobile organization, which is great, but a lot of people don't realize that it's not just as easy as, oh, I can call the Planned Parenthood that's nearest me, make an appointment, and get in. They're already talking about people from the Twin Cities are driving to Duluth because it's a shorter waiting time. So when somebody contacts you, from out of state or even, from an outstate region, what are some of the things that they need that support with? What are some things that they're asking you for?
Yeah, so when they contact us, typically they've already scheduled their appointment at one of the clinics. And they're asking us for funds. Like, they're asking us for ride to the appointment, like to and from their hotel. They're asking for us for the hotel. They're asking us for us to fund the appointment. And yeah, we can fund the appointment, but a first trimester abortion in clinic starts around $600, and our funds for first trimester that we can offer each person usually varies between $150 to $200. So that means we're having to connect people with additional funds outside of what we are able to offer too. And in regards to like who can provide abortions, it's even less than what you've described, Jason. Like, the real tea is, yes, there's a Rochester, Brooklyn Park, Uptown, Planned Parenthood, but those Planned Parenthoods are not offering in-clinic abortions. They're just offering the pill. Just the pill. They're offering just the pill. And so when you think about people accessing abortion and Minnesotans having to travel outside of Minnesota to access abortion care, it's because there's only 2 locations, Whole Woman's Health Bloomington and Planned Parenthood in St. Paul, that are offering in-clinic abortions up until the second trimester. And then the Duluth offers up to 16 weeks. So if you can't get in there, and the person that I spoke about in the clip who has appointment on June 1st, that's a first trimester person. So they're already waiting. First trimester person is waiting. You know, a second trimester person is going to have to wait even longer. So that's why we end up sending people out further to Seattle. I have somebody in my emails right now. We're going to Colorado because there's not a lot of accessibility when it comes to second trimester. So I think the conversation has become a little bit flat when thinking about abortion access. We need to get a little bit more deeper and nuanced with, like, what type of abortion access are you talking about? If you're talking about the pill, yeah, pills are easy to come by. We can get you that. But surgical abortions, second trimester surgical abortions, you might have to try that.
As an ignorant person, like these facts are a little shocking to me, and I think they will be shocking to some of the people listening. The fact that it's, even if you live in Minneapolis, in Uptown, you think I've got a Planned Parenthood right here in the Wedge. You think, well, it's a simple thing for that person. Thank God they live where they live. But that's not really the case. So we've talked about the legislative barriers. How do we overcome the barriers to providing more access, increasing the capacity that we're not meeting the demand that currently exists? We're going to have a real hard time meeting the demand that is sure to come. How do you reduce those barriers, providing the services where people live?
The easy answer is us winning the lawsuit and advanced nurse practitioners like physician's assistants, nurse practitioners, even nurses, midwives can provide abortions. Like, giving them the green light to go ahead and provide abortions. That's an easy answer. Like, yeah. Making it more accessible in people's communities so they don't have to travel. They don't have to go to a specific clinic. Like, they can just go to their, like I said, midwife or nurse practitioner or physician's assistant that they see, and they offer the abortion services. Because of laws in the state of Minnesota, people are not able to do that. And that seems like, a really easy fix, but I think that's just one part of it. There's a second part of it that I think complicates it a little bit. One, like, what are all the logistical things that need to happen for a nurse practitioner or other advanced practitioners to be able to offer abortion care is training. Who's offering training? The University of Minnesota had a program at one time that they cut. So, Driven to Discover, they're not trying to discover anything about supporting people who offer abortion care. So that's one barrier. That's one barrier. Another barrier is, like, because the U of M, they also could offer, more abortion care, second trimester abortion care, but it's a very unclear system on how to get people into the U of M for abortion care. It's like a referral base, so you can't just, like, go to the U of M and roll up and pull up and be like, hey, I want my abortion. You have to get referred from a provider, and it's, I would say the U of M is not very abortion friendly based on my experience of working and trying to get people in the U of M. They do great work. However, they could be more expansive and more opening when it comes to, being able to provide trainings for providers to be able to offer abortion care and open up their second trimester care, because we have people traveling to another city, other states, when you are supposedly, like, one of the best schools in the U.S. and you're having people travel outside. That don't make no sense.
Yeah. Do you know, is that just because it's politically unpopular, or was there, like, some sort of funding issue or something like that?
Yeah, some funding was threatened to be pulled.
Before
For that program specifically, I should say.
Yeah, that makes unfortunately a lot of sense. That's been the method through which a lot of these services have been denied to people is, trying to limit who can access things by saying, we're not going to fund you if you provide this type of care, or we're going to make you jump through a lot of extra hoops to get this sort of, or to offer this care to patients and things like that, with trap laws and things. So, when we look back at, the before time of before Roe v. Wade, obviously things were very dangerous for people seeking abortions. And, I've spoken with people who are like, oh, my mom drove up here from Mankato as like right after Roe v. Wade so that they could get an abortion and things like that. When you look at this landscape, it's definitely scary, but what are some things that make you hopeful that we, at least in Minnesota, are going to be able to maintain what we have in terms of abortion access?
I think people are very, they're willing to throw down, and they're willing to throw down like anyway. They're willing to throw down their time to volunteer. They're willing to open up their houses to people who want to come here. They're willing to throw down money, show up at rallies. And so I really think it's, the community. That's what I'm relying on. And that's what the reason why we have the abortion fund, because it was the community caring for each other. Stephanie, who used to be the board chair of our justice, said that, we're the OGs of mutual aid. We were mutual aid before mutual aid was a word. And we've always shown love for our neighbors in our community by getting money and resources together to make sure that they have access to abortion care. And that's something that we've done before Roe v. Wade. That's something that we'll do after Roe v. Wade. We just know that there's so many resources, so much knowledge, and so much opportunity within the community that we can tap into. A lot of people are talking about SMA, which is shorthand for self-managed abortions. And I know that our history with self-managed abortion includes some things that are not really cute, some things that are dark, some things that are hurtful and hard to reflect upon and think about. And that's just not the whole story of SMA. There are a lot of different ways that people took care of each other in the past. What I always go back to is I am a descendant of enslaved Africans who used cotton, who used papaya seeds, who used okra to pass their pregnancies, to self-manage their abortion. And so the knowledge is there. When Black people had granny midwives in their communities delivering their babies, we had higher success rates than we do now going to the clinics and going to the hospitals. So I really think it's like a hybrid of putting the knowledge and the resources back in the hands of people, especially when it comes to communities of color, because as we can see now with the maternal mortality rate and how it's really high for indigenous people and Black people in Minnesota, and we in Minnesota have some of the best health care, there's something missing. You see there's a disconnect there. So I think it really goes back into putting it back in the hands of people and trusting the community to do what's best for what they think is best for themselves.
Yeah. We'll be right back after these messages.
So you will, if we can't get Taylor on the line, you will play the role of Debbie in sales and perhaps respond to my reading of the ad. That's all that will. Did you see Taylor's version of the
I have.
ad recording?
Yeah.
Wedge Live is sponsored by Dispatch, sending you reports from the bustling Minneapolis and St. Paul arts and culture scene. For May, Dispatch welcomes us all back to Filmtown with a profile on the return of the MSP Film Society in their new home at St. Anthony, Maine. Plus, there's the return of the Red Eye Theater, comedian Maggie Ferris's new album, the Caterwaul Music Festival, and much more. Check it out at dispatchmsp.com. That's dispatchmsp.com. How'd that go?
It was all right. John just had a really great conversation with Asha Hassan yesterday, who's a researcher at the U of M studying reproductive rights and racism, and talking about the drastically different outcomes that we're seeing for Black people and Native people and people of color versus white people, it really underscores the difficulty and a lot of the structural racism that we encounter when talking about any sort of healthcare, much less reproductive healthcare and abortion care that carry a lot of other stigmas. Are there things that you think are helpful to reduce those stigmas and that we can kind of engage in to help those communities that are struggling more with accessing care or getting quality care?
I think in terms of reducing stigma, just saying the word abortion, a lot of people want to say pro-life, pro-choice, or they want to say a woman's issue or reproductive health issue. Just say the word abortion. Like, we've been begging the president to say it, and the only time he said it when he was talking about anti-points. And so I'm like, why can't you just say the word? It is a medical procedure. It's a medical process. It's not a dirty word. Just say the word. I think introducing it in terms of conversations of like abortion is healthcare. Abortion is healthcare. Introducing in those conversations. Not having conversations about like birthing justice without having conversation or including abortion in that conversation. Yeah, I think those are some ways that we can talk about stigma. The house parties that we host or we have our supporters host, those are great ways to like debunk stigma. Yeah, just talking about it, sharing social media, like following people on social media who talk about abortion. Like, there's so many different ways. I don't think that stigma is going to be the only thing that we have to bust in order to make sure that people who are marginalized access, safe abortion care. The reason why it's so hard for us is because there are systems in place. The same system that makes it hard for me to access abortion care is the same system that makes it hard for me to make a living wage, is the same system that makes it hard for me to, get child care or, take care of, my children or even get like secure housing. All these systems play into each other. And so I don't think it's just so much like, even if we had all the money in the world that's poured into our justice, we're never going to have enough money to like fix a broken healthcare system.
Yeah. And that's, it's so frustrating when, we can have this conversation around, like you said, housing, education, economic justice in terms of who gets paid living wages and who has access to education to get jobs that make higher wages and things like that. And that's one of the things that gets really heavy and really easy, I think, that makes people sort of throw their hands up in the air and say, well, there's nothing I can do. But that's one of the reasons why I really appreciate what you're doing at Our Justice, is centering patients and doing that direct frontline work. I really appreciate that and all that you've been doing. It really means a lot to the entire community, whether they realize it or not.
So in 2016, we had a big presidential election that really changed our culture and our politics. And there was a reaction to that kind of shifted some responsibilities to local governments on issues like immigration. And I feel like this will be a newly relevant topic for some local officials. What should we be demanding, expecting from either city council, county board, Hennepin County attorney? What do we want our elected officials on the local level? We know what we expect from the national politicians, but what do we need the local officials who are nominally pro-choice? What do they need to do to follow through on that commitment?
Yeah. So Our Justice and Pro-Choice Minnesota have been working on an initiative with the Minneapolis City Council, and hopefully we can move it on to St. Paul because St. Paul is popping too. but we've been working on an initiative to make sure that there's reproductive justice and abortion care funds in the budget. Like, fund abortion. It's a pretty, I guess it seems like pretty simple. Like I said, like, no, we're not going to solve all the problems with money, but like in the meantime, when we're working on solving the problems, we do need the money. So fund abortion, fund this transportation that we're giving to people when they go to and from their reproductive health appointments. And when I mean reproductive health, I don't mean just their abortion appointments, when they go see their doulas, when they go, get their checkup, their annual checkups, when they go ahead and get their IUDs or any other kind of birth control that they might get. We need to fund that transportation and childcare for that too. I would say a whole childcare wraparound service. Like, all the folks that I know who are like talking about abortion justice and reproductive justice are also talking about childcare. Like, I don't know how people with children do it. Shout out to y'all. Y'all are doing the dang thing, because I heard that childcare is like basically having a mortgage, another mortgage. And so making sure affordable housing is like a big thing. And so whatever we can demand from our city officials in terms of like affordable housing, or not building up new penthouses in the city that go unoccupied for months and years on end, like those things are a reproductive justice issue. Because if you can afford your home, you might have some extra money that you can afford your abortion.
I guess I just have one more quick thing that I wanted to ask you, Shayla. You've talked about a lot of the different resources that people need. I know the Spiral Collective is out there doing abortion doula work. What are some organizations, along with gender justice and things like that, that people should be paying attention to as well, or that you'd just like to give shout outs to?
Yeah, gender justice, of course, they're the bomb. Spiral Collective, they are not only just doing the doulas, but they do transportation to and from appointments. They put care packages together. They feed communities. Spiral Collective does so much because even though they're like a small group, they think in abundance. They use their 501c3 to like support like the Netamasing Gishmakikinan, which is a native breastfeeding group. They support Cocoa Butter Futures, which is a food pantry, and they do redistribution of cash to BIPOC, queer and trans folks, and BIPOC single caregivers who are taking care of elders or vulnerable adults and children. Spiral, I can't say enough about them. Those are my homies. Hot Dish Militia, holding it down for us in Duluth, and their TikTok is incredible. Like, follow the We Held Duluth TikTok. I can't stress it enough. Everybody in the Unrestrict campaign, Unrestrict Minnesota. If you want to know anything in regards to policy and like how to like push legislators to do the right thing, Unrestrict Minnesota is your political home. You should be following them. And First Unitarian Society. They have been holding it down for us. They're super sweet. Those are my shout outs.
Well, before we ended, let's put in a plug for Our Justice. We've mentioned that you don't have the resources you need to meet the current demand.
No.
The demand for what you offer people is going to go up exponentially. And so put in a plug. It's ourjustice.net. People should give what they can to support the work you do. Do you have anything else to induce people to support your work?
Yeah, just give what you can. $1, $100, $10,000, whatever you have, we'll accept. We were able to sustain ourselves through the pandemic, and it wasn't because of like big funders. We don't have no money from the any public money. Like, no public funds go to us. We don't get all that money that goes to the crisis pregnancy centers who lie to people. We don't get that. But you should talk to your legislators and talk to your representatives about why all your money for reproductive health is going to folks who lie to people and try to manipulate people out of abortion care through the crisis pregnancy centers. There's 98 of those crisis pregnancy centers and only 5 abortion providers. You need to ask your legislators about that. Yeah, we were sustained by the monthly donors. And I think, that's what I want to give a plug out for. Even if you're a monthly donor who gives like $2 or $5, it don't matter. The monthly donors is really what sustains our work, because things will shift. This political time is going to shift. Something is going to be new and hot in a week or 2 weeks or a month or whatever. But what doesn't shift is like somebody's monthly commitment to abortion access. And so, I'd rather somebody give us like consistent money instead of just like a one-time great donation. Like, stay true to your values,
Yeah. Yeah, 'cause it's going to fade from the news, and you want to sustain that commitment over a long period of time.
Mm-hmm.
Thank you, Shayla Walker, from Our Justice, Reproductive Justice Organization.
Yes.
The website is ourjustice.net. Jason Garcia, thank you for co-hosting and taking the lead here today.
Thank you for having me, John.
And thank you all for having me. And last shout out, I want to give a shout out to Angelica. Angelica, you know who you are, boo. She loves the Wedge. She's like, oh my God, I can't believe you're going to be on there. And I'm like, yeah, I am. So shout out to Angelica.
Hello, Angelica. This has been the Wedge Live podcast. I'm your host, John Edwards. Thank you for listening.
This is a real thing. Real thing.
None of you have the balls to stop this. Stop this.
I've got plenty of time. I have nothing else going on today.
We're in the Wedge neighborhood right now.